The other thing he talked about, which I also want...
In Uganda, traditional medicine, including the herbals, play an important role in managing diseases. However, Uganda is listed in the top 10 countries faced with a high rate of the herbal medicine extinction. Speaking to the press today, the officials from the Ministry of Health and the National Drug Authority, together with the retired Deputy Chief Justice Steven Kavuma, have unveiled the 22nd African Traditional Medicine Conference based on the theme Support Provision of the Quality and Safe Traditional Complementary Medicine through the Appropriate Regulation.
This time round, the emphasis, as you've heard, quality and safe through appropriate regulation. For the 21 traditional medicine days, we've been having various themes, some of which would be advocating for planting medicinal plants in forests, or bridging the gap between modern and traditional healers. But this time the focus is this traditional medicine that is becoming so popular, most especially since COVID-19 pandemic. We need to see, what are Ugandans taking? Is it quality? You know, we hear people claiming all sorts of things. Some could even come and say, I'm putting my medicine in capsules.
Dr. Grace Nambatia, the researcher in the Ministry of Health, noted that the quality and the safety of the traditional medicine needs to be regulated by the government to prevent the fake and contaminated traditional drugs from being used or put on market for consumption.
To really discuss, or like in Uganda, we would get stakeholders in the arena of regulation to discuss these issues and really see how we end up with quality products. So when we talk about regulation, one would wonder, who are the regulators? On top of the list, we have National Drug Authority. Then we have other regulators like National Bureau of Standards. We have Uganda Registration Services Bureau, because it touches the issue of intellectual property.
The retired Deputy Chief Justice Steven Kavuma noted that in COVID-19, the medicine has helped in killing the virus, while the traditional herb. He therefore urged the public to change their mind on the herbs and embrace them as they reach in terms of boosting the health.
One time I was talking to a relative, a close relative, and I said, but look, I've got this, and he said, but that was made in where? I said, by a Ugandan here. He said, no, me, I don't want to touch local medicine. That is the highest degree of ignorance. That is the highest degree of ignorance. And we must fight it right from the people, because they are suffering from ignorance. Even if somebody could be a PhD holder and is suffering from what we call secondary ignorance. You may know very much about what others know, what about others do, but you don't know much about what you and your own people do and can manage.
Dr. Dan Mayanji explained how traditional medicine has added value to the growth and development of the country.
Right. Ladies and gentlemen, as you must know, the Africa traditional medicine is a major sector in this country. If properly handled, this sector can contribute very much to the economy of the country.
According to the World Health Organization, over 80% of the African population rely on the traditional medicine for their health care needs due to its popularity, accessibility, and affordability.
Are we done?